Hi, my name's Luca. I'm a 52-year-old self-employed plumber. Pretty active guy, obviously active at work and walking at least 3 or 4 times a week, gymming maybe twice a week. Pretty healthy sort of guy. Only issue I had health-wise is my eyesight's obviously deteriorating. That's due to my age, but I was getting yearly checkups. So every January off I'd go to the optometrist, we'd get our new prescription glasses, everything was fine. This year I've gone up there, the usual eye test, and gone in to see the optometrist after it, and basically straight away said to me, "Are you a diabetic?" To which I replied, "No, not that I know of." I had previous history in the family. My mother's a diabetic, she's on insulin twice a day. My father was a diabetic the past couple of years ago, but he was on metformin. And I had a previous, probably 8 years ago, was diagnosed with pre-diabetes, to which is hence why I become pretty healthy. And I was able to sort that out, all clear, and just went on my way again, and just living like a pretty healthy lifestyle, but maybe dining out 2-3 times a week. I was probably drinking, obviously, when we did do that. But other than that, felt fine. Had sort of started to get back into a really active lifestyle again. But anyway, so he basically said to me, this condition only occurs, it's a diabetic macular edema, which only occurs if you do have diabetes, and it's caused by obviously high blood sugar, and it's putting pressure on the back of your eye, which makes your back of your eye leak fluid. So sort of hit me for 6 actually. Wasn't expecting it, but so walked out there basically resigning myself to that I am a diabetic. It was just a matter of how severe it is and what level of diabetes I'm at. So gone home, basically straight onto the internet, checking out, can this be reversed, and how you go about it. So from what I've seen, it can be reversed. A lot of it's to do with diet. I've studied a lot of stuff by Professor Ross Taylor out of Newcastle in the UK, and he's basically putting all of his patients on a low carb, 800 calorie a day diet for 8 to 10 weeks, and trying to reduce their weight by 15%. So from here, I've got a referral that I was given probably three months ago from a doctor to go with a blood test. So today's Monday. I'll be up for a blood test tomorrow, and I've already booked in to see my GP on the Thursday, and we'll go from there. Hi everyone, so I've been to the doctor, my local GP. I was able to get in there fairly quickly because the optometrist gave me an accompanying letter that said that you need to see a doctor straight away. Went in there, he asked what I was here for, handed in the letter, which he read, and I said I just had a blood test 2 days earlier. Opened up my results, and his basic reaction was, "Oh yes, you've got serious diabetes," which knocked me for 6 really. Was expecting probably diabetes, but not a serious diabetes. So from there, I asked him, where do we go from here? He said, basically, this condition will be controlled through medication. And from here, we'll set you up an appointment next week to see your diabetes care nurse. What that involves, I presume, will be dietary needs, podiatry, and whatever else goes with that. He then issued me a script which I had no idea, and he did not give me any instructions on what I'm about to be given and what to do with it. And basically said, you're on your way, go from there. So we walked out, obviously really devastated. Renelle was with me, and it was, it wasn't a good feeling, but from there went straight down to the chemist, handed the script over, come back, and basically said, the chemist said to me, so you're obviously on this sort of medication, you know what you're doing with it? And to which I replied, no, I've just been handed this script, to which he was fairly surprised at what I'd been subscribed by the doctor. So he also said I had high cholesterol, so I was giving a Capstat, which is a statin, which is obviously to do with reducing cholesterol. He put me on Glyade, which after having a look what it was all about, it's basically a substitute for insulin, and I was put on metformin. So the chemist was sort of surprised that he put me on such a lot of medication that quickly. He sort of said, maybe you might want to start on just the metformin and see how everything goes, to which I did. I come home and I had one tablet. I don't like medication. Renelle's probably a bit more of a worry than me. She said, you've got to start taking this. And I said, no, I'm not. I'll take the metformin, but at this stage, I don't want to put any sort of, I don't want to go down the insulin track with this. And the cholesterol, well, I have a theory on cholesterol that's not as bad as everyone makes out. So I'm only going to take the metformin at the moment, and have a meeting with this care nurse and see what her suggestions are regarding diet and overall care, and we'll go from there. Been 7 days since my diagnosis of my severe diabetes. Just recapping some of the symptoms I had. So I had the diabetic macular edema, which was spotted by the optometrist, and that's what's kicked everything off. Another symptom I had was tingling in my toes, which I still have, and it's quite noticeable. Probably got that a month before the diagnosis, and I just thought it might have been a little bit of gout or something, something that'll pass. But it's something they call peripheral neuropathy, which is a diabetic condition, and it's basically damage to the nerve endings. It can happen in your toes or your fingers. Another thing was urinating a lot through the night, just thinking, well, age is catching up. That's just what happens apparently. And also a bit of tiredness, getting fairly tired at work around the 1-2 o'clock. I was usually looking for a coffee or something to get me going again. So that were the 4 things that probably, looking back, were symptoms of my diabetes. So I had a meeting with a dietitian and a care nurse, and quite positive actually. I spoke to my dietitian regarding the way I was going to attack this. I've looked at a lot of, also want to say my weight. I had started to get into weight loss before I was diagnosed. So at the time, I've got a picture here, I was 79 kilos, and that was probably 4 weeks before I was diagnosed. A lot of people say, well, you're only 79 kilos, like how have you got diabetes? But 79 kilos is probably, well, obviously too much weight for me. So everyone's sort of looking into diabetes. You don't feel that what you call fat to be diabetic. It's all about the visceral fat, which is around the organs in your stomach. So a lot of people carry a lot of weight through the stomach, and obviously it's, carry the gene that does, brings on diabetes. So after doing a lot of research through YouTube, a lot of video watching from guys like Dr. Jason Fung and Dr. Ken Berry, Ron Taylor, and another guy, Dennis Pollock, another guy out of America who actually has diabetes, and the way he's treating it, very informative. But they've all got the same idea about basically cutting out carbs that poison the diabetics, and losing weight, obviously, and also exercise program. So the way I'm going to attack this is, because the diabetes is severe, I'm going to take this head on and go down the track of really attacking this as hard as I can. So based on what research I've looked into, I'm basically going on a keto diet, which is cutting out all carbs. So that's breads gone, rice, pastas, potatoes, sweet potatoes, any vegetable in the ground, and of course, obviously sugar. All alcohol gone. I'll only be drinking water, tea and coffee. And the other thing I'll be doing is intermittent fasting. So 5 days a week I'll be eating between the hours of 12 noon and 6 in the evening, and I'll be having the 2 meals, no snacking in between, and I'll restrict myself to 800 calories a day. And on the other 2 days I'll be doing basically 24-hour fast. So I'll only be having the 1 meal 2 days a week, and on the other 5 days obviously the 2 meals. The other thing is exercise. So I'm going to try and walk a minimum of 10,000 steps a day, and I just track that through my iPhone, which surprising how many steps you can do. Well, especially me, I'm a plumber, so a lot of it's just at work. I might do 5,000 at work, but coming home, making sure I get those 10,000 in a day, and I'll accompany that with a gym program, which I had already started, and basically it's just your push-pull leg program. So trying to get at least 5 days a week into the gym, only doing my hour in there, focus basically with a warm-up to start, and then just a weight program. So just your push, basically, your dips, military press, dumbbell, chest workout, your pulls, your seated rows, face pulls, pull-ups, and the third day will be my legs, which are basically squats, leg press, a bit of core work obviously to go with that too, some planks or sit-ups. So this is the way I'm going to attack it. I'm going to give that 2 months, and I feel really positive and really upbeat, because this is definitely a reversible disease, and I'm really up for the challenge. And I'm really looking forward to putting this disease to bed, like getting it under control and living a long and happy life.